A lot of people think that when they're having a heart attack, they're going to have what the movies show them, which is that they're having a crushing chest pain and they will fall on the ground. Well, the reality is actually far from it. The heart attack can come in various forms. The most common form is that you are having a chest pain, but it's typically not a crushing kind of pain. It's typically described as a heavy kind of a discomfort, as if someone is sitting on your chest. So if you have any kind of pain, if you are short of breath, if you are sweating heavily, if you have nausea, vomiting, or burning, which is not going away, and if you have risk factors for heart disease, then you need to be concerned that you're having a heart attack. And one of the main things that we can decrease the high mortality is to call 911 and help our first responders to take care of patients as quickly as possible. And the sooner we call 911, the better the care is going to be, because not only that will reduce the time then the care starts, it will also reduce the time till the patient arrives in the hospital and they are taken to the cath lab to take a look and find out what is causing their heart attack. So, at our facility at Alliance Health, we are a chest pain accredited center. That is an extra qualification that requires meticulous attention to quality care. And we went through a lot of steps to make sure that we get chest pain accreditation. And our motto at our hospital is that we will provide quality care, because if the quality is there, the quantity will follow. So, coming to your questions about what happens when a patient comes to our facility. So typically the EMS sends us an EKG. We evaluate the EKG, and if the patient is having acute heart attack, we activate the cath lab team. We typically arrive within 30 minutes. And our goal is that the time when the patient develops the symptoms till the time we open the artery, it should be less than 90 minutes. We try to achieve a target of 60 minutes or less. Once we take care of our patients, they typically go to cardiac care unit, where we have excellent nurses who take care of our patients. And our goal is that we would want our heart attack patients to go home within 48 hours. Now, the care that we provide doesn't stop there. We refer all of our patients for cardiac rehab, which has shown us to be associated with significant reduction in both mortality and morbidity. And then we follow them up very meticulously in our facilities to make sure that they don't develop any recurrence. What can people in our state of Oklahoma can do to reduce their risk of having heart disease? And it all comes down to primary prevention. Our emphasis is that we should not get any cardiovascular disease. So how do we do that? The most important thing is quitting smoking. The single best thing that we can do to improve our health and longevity is to quit our smoking. And that's what I tell to all of my patients. I tell them that I can put in 100 stents in their body, but no effect will come close than the effect that quitting smoking will have. Quitting smoking is the single best thing that they can do for their health that will make them live longer and live healthier. 2, regular exercise. Brisk walking for 30 minutes most days a week is the best and most easy exercise that you can do. You can do other forms of exercise too, but we emphasize on walking because it's easy. You can do it practically without requiring a lot of equipment. 3, eating healthy. What is eating healthy? So in plain terms, eating healthy means you need to avoid eating sweets and reduce the intake of your red meat. You should eat more fresh fruits and vegetables, low-fat dairy products, more white meat, fish and legumes. If you consume this diet, we have data to prove that it leads to decrease in the incidence of cardiovascular disease. And if you have cardiovascular disease, it reduces the mortality and morbidity. And number 4 is that if you are diabetic, you need to make sure that your diabetic control is good. And a good diabetic control is that your hemoglobin A1C should be less than 7. And again, it comes out to the same thing about eating healthy, making sure you exercise, and making sure you take care of what you eat. And if you do these steps, you can markedly reduce the incidence of heart disease. And I think we need to emphasize it not only to our patients, but to the entire families, to our kids too, because the habits that you form when you are growing up are the habits that last you forever. So if, as adults, we change our eating habits and we eat healthy, we exercise, we don't smoke, and we take care of our health, our youth will see the same. And in generations, we should be able to decrease this high risk of cardiovascular disease.